Hey everybody, Dr. Steph here, and I wanted to give a quick note of something that I'm seeing a rash of in my practice, and I want to explain a little bit about how chiropractic can help. So most people know that I see children in my practice. You've seen the pictures, and a lot of people are like, what the heck is that all about? Well, one of my first children in my practice that I saw was for ear infections. So I want to explain a little bit about, number one, I was so successful with so many kids that I did lectures about it and I went to schools because quite frankly, it's the number one reason for antibiotics and for ER visits in children. And the number two surgery are tubes in the ears. And tubes in the ears, the only other surgery that's higher than that for kids is circumcision. So I wanted to explain to you guys right now why, because when you understand the why, you're going to understand what's going on. So my Aunt Dee had a pool. I grew up with going to her pool, and in the spring, she'd pull the tarp off the pool, and it looked like a swamp, like, you know, Day of the Dead, like zombies coming out of it. And what they would do is they would put shock in the pool, right? So anybody that grew up with a pool knows they put this chemical in, it was a wham, and chlorine and whatever that is, that would kill everything in the pool, and then the pool would be this crystal clear water. That is not unlike what happens with ear infections. So what happens in an ear infection is that those ears, that inner ear, should be draining through something called your eustachian tube. And when that eustachian tube gets closed, and we're going to talk about that in a second, the reason why, that inner ear becomes like that swimming pool. It's hot, it's moist, and things grow. And when things grow, it gets infected. And so what do we do in our society? We shock it. We shock it with the antibiotics. I had a patient with 6 sets of tubes, and we're going to talk about tubes in a second, and failing every time, losing hearing. I had another patient that is like 15, 16 months and had been on 4 rounds of antibiotics in the last month and had been on, I don't even know how many before. And all have, recovered. And so I want to talk to you about the why. So I'm going to flip over to my charts. So this chart really tells the story because the nerves from this part of the neck go in. Now the ear isn't here right here, but the nerves from this part of the neck go in the ear. What we have to remember is that the nerves that run your body come out in between each one of these vertebrae. And when we're looking way at the top of the spine, the nerves from that area, it's actually your brainstem, go into the eyes, into the jaw, up into the brain. I had another one that's having trouble sleeping. And so, hey, when you're doing Facebook Live, you should probably not let your phone ring. I just learned that. Anyway, back to this. So the tubes or the nerves from here go into there. So I'm going to come back here and I'll talk to you. Okay. So there's a nerve. If something is off in that upper neck, that can pinch or irritate the nerve. What a chiropractor calls that, they call that a vertebral subluxation. What that means is that the nerve that's coming out in between the vertebrae, and in this case, in between, where the head and the neck meet, when that is not in the right alignment, it can do this. A lot of kids are growing up. They wait, when they're first born, they prefer one head turn to the other. That can be a sign that the upper neck is not in the right alignment. Torticollis is what it's called when it's at its most worst. But a lot of kids have it and they don't even know it. Look at your kids. Do they all have a head turned to one side over the other? That's one of the things that you're going to want to look for. Anyway, so back to this. So there's a muscle in there. It's called your tensor veli palatini muscle. So if you've ever woken up with a crick in your neck, this is a crick from the neck that goes to this muscle, and that muscle opens and closes the eustachian tube. So guess what? A little spasm in this muscle stops the drainage. So a pond is not stagnant water. A pond has water coming in, water coming out. And what we want in these ears is we want them to drain. What tubes do is they puncture a hole in the eardrum and create an artificial drain. Well, God made the body with a drain. If you've ever been on an airplane and you had your ears popped, that's your eustachian tube. So that's what we do, and we have a series of very gentle adjustments. See that? That's the amount of pressure I use on a baby. Or if I'm checking a tomato for ripeness. Very gentle techniques, really effective. If you live in Chicago, come, call me, instant messenger me, I can help you. If you don't know somebody that can help you and you don't live in Chicago, instant messaging me and we'll find you a kick-ass chiropractor that's going to help you with this. You do not need to put your kid on the antibiotic roller coaster. If you don't know what I'm talking about, ask around, because this is the thing. So I hope this is helpful. Any messages you have or any, questions, please feel free to put it in the comments. I just want to do these periodically, and this is something that came up. I've said this same thing 3 times in the last 2 days because I've had so many kids with ear infections. So hopefully this is helpful, and I hope you all have a great day. Take care.